Hey, yo, James. This is a small example on how you're supposed to probably um, solve questions, right? Uh, Maybe like just approach some questions the right way, and without much ado, let's begin. So, the first question that we have here is: a 65-year-old man comes to the office due to skin condition. For the last 6 years, the patient has had slowly progressive depigmentation, alright, involving the face, posterior scalp, hand, genital area. There's no itching, pain, or scaling, and that's important. Medical history is notable for hypertension, stable coronary artery disease, and look at this rheumatic condition that you're kind of hinting towards. There could be a hint there somewhere. Skin examination shows widespread areas of depigmentation as shown below, right? Physical examination is fair. All right. So the first few things that would actually come to your head is that there is no itching and there is no pain. So there's a high chance that this could be uh, something which is non-itching, non painful, non-scaling, something like a segmental or a patchy vitiligo. If it is involving a segment, then a segmental or an isolated, depending on what that condition is. Also, something else that we know that's associated with rheumatoid arthritis. So there's a high association between rheumatoid arthritis and vitiligo. So yep, let's just look at what explains the best explains the pathology of this patient's condition. The importance is that it's a slowly progressive patchy depigmentation, and it involves some regions, all right, of the hands, genital, and feet. Correct. Um, so it's patchy depigmentation, and the question is which of the following explains the best pathology, uh, best explains the pathology of this condition. So obviously, the melanocytes are the sites of melanin, right? They have melanosomes which have melanin in them. Now, the amount of darkness of a skin depends on three factors. One is the transfer of melanin to the melanocytes, to the keratinocytes, sorry. That's number one. Number two is the number of melanosomes, right? And number three is the amount of melanin in the melanosomes, obviously. So, this is not associated with an infection, definitely. Uh, there is no inherited absence because it would be since birth then. Is there an age related depigmentation? Let's see that. And is there destruction of melanocytes? Looks a lot like that. Let's look at the other things. Post inflammatory changes. I mean, why aren't there any inflammatory changes? Why is it then a pruritus? Well, there's no pruritus, so I would like to rule that out. Is there a superficial fungal infection? Um, well, if it was that, you're looking at something like a pityriasis versicolor. This is definitely not how it looks. So destruction of melanocytes. Let's have a look at the answer. And yes, it's destruction of melanocytes. And as we predicted, it's vitiligo. So that's how you just generally approach the question on what it is, why it is so, and what can we do for it, right? So that's one way of approaching the question. Thank you very much.